With LASIK, it is also laser vision correction. So here's our handy model, here's our cornea. With LASIK, it is a quicker recovery and it is a more popular surgery. In LASIK, a flap is made in your cornea. So when we make this flap, we lift it up and we expose the layers that we need. We do a laser on those layers, and that's where we either make it steeper or flatter, or we change the shape to allow the light to focus properly to the back of the eye with the help of the lens in the eye. At the end of the surgery, we put the LASIK flap back down. So we have not disturbed any of the skin on the surface of the eye. So with regards to LASIK, it's a very successful surgery. The surgery recovery can be quicker because of the decreased amounts of disruption on the eye. Now, it is uncommon for somebody to get hit in the eye and dislodge the flap. But if you do some types of work where that could happen, then other types of surgery might be more beneficial. We do need to remember that that type of injury is not common. However, LASIK also requires a little bit of a deeper cut because we're making a flap and then you cut deeper into the cornea. In patients who are vulnerable, that could lead to increased amounts of dryness in the eye. And the reason because that is that we ablate nerves. I mentioned in an earlier video that the cornea has a lot of nerves. So if you cut out a lot of nerves, well, you can kind of numb it. And so the surface of your eye, the functioning of how it works and produces tears and how it senses stuff can change. The other thing is if I take the foundation of something and I really, really trim it down, well, it can get weaker. And then over years, 5, 10, again, 15 years, it can start changing. And we call that ectasia. And so a careful evaluation of your eye to see if you're a good candidate for LASIK would be necessary. But overall, LASIK is a very safe and effective surgery to help you get out of glasses and contact lenses.